My name is Dante Quijano, and I'm Ada's dad. I am a registered nurse in the operating room, and I've been working in the operating room for about 16 years now.
Alright, first question. How many hours do you work in a typical week?
I work 8 hours a day, 5 days a week, so that's 40 hours a week.
Alright, next question. What other healthcare professionals do you work with?
We work with a variety of different type of techs. We work with anesthesia techs, surgical techs, x-ray techs, SPD techs, SPD standing for Sterile Processing Department. We also work with others, registered nurses who specialize in the pre-op as well as the recovery area. We also have registered nurses who specialize in the operating room. I also work with a variety of different doctors. Work with pathologists, radiologists, anesthesiologists, and surgeons.
Alright, tell me about your background and education experience.
Well, straight out of high school, I didn't take the summer break. I went into summer school immediately to try and get ahead, and started all my prerequisites for the RN program. But since the programs were impacted, I finished my prerequisites. I decided to go to LVN school first to get into and finish that and get into a step-up program, which I did. And a year after I finished my LVN, I got my RN degree. And then another year after that, or year and a half after that, I got my 4-year degree in nursing. And then after that, I wanted to work in the operating room, so I needed to go to an OR program to become a surgical nurse.
Alright, next question. Describe a challenging situation you've had in your job.
We are all part of a highly reliable surgical team, and the challenge that we have sometimes is when we get brand new OR staff or staff from other facilities, and we try and train them to be part of that highly reliable surgical team. We train not just to be average, but we want our staff to be all above average.
Alright, last question. Describe the activities in a typical day in your job.
Well, since I'm the orthopedic nurse coordinator for the operating room, I come in 1 hour before everyone else does. What I do initially is just look at the computer and I check lab values for our patients to make sure their labs are within range to have surgery. If not, I will call the surgeons at that time and let them know that there's probably issues in their room. After that, what we do is we set up all the rooms for surgery. We provide them with all the equipment, all the different positioning devices that we have for the cases for the day. So sometimes we have the patients on their stomach, sometimes we have them on their back, and then sometimes we have them on their side, all depending on what type of surgeries that we do. We also have a variety of different beds that we use for the different types of surgery that we use, so I make sure those beds are close by. What we also do is we make sure we have all the necessary equipment for those cases. For orthopedics, we use mallets or hammers. We do use drills. We use saws. We put plates and screws. We use live x-ray, so we also make sure those are in the room as well.